The healthcare system is designed to promote wellness and look after patients. We need to look after the employees.
Si nos gestionnaires ne sont pas bien, toute l'équipe s'écroule.
Our most precious resources are our people.
Most of us in the health world are really focused on the outcomes, on how to get healthy people in this country and really improve the health of Canadians. So the starting point for that is the workplace and making sure the people that provide that service are as healthy as they can be. It comes back to that recognition that the health of Canadians really depends on having healthy providers. They really can't be separated.
The healthcare system is designed to promote wellness and look after patients. We need to look after the employees. If we have healthy and well employees, then that's going to promote better safety for our patients, clients and residents in our organizations.
I'm so glad that the CMA is involved, and we need to continue to get more doctors involved in this issue.
If you want your employees to take care of your patients, you need, first of all, to take care of your employees. And by doing that, the best thing to do is to look at QWR. By working on QWR, you raise your employee well-being, your employees' perception regarding the organizational support they can get from you, and all of these strategies have a great impact on employee satisfaction, employee productivity, and the quality of care your employee can provide.
Tout ce qu'on recherche comme professionnel de la santé, c'est d'assurer une qualité auprès des services à la clientèle, alors une qualité des soins aux patients et la sécurité des patients. Et on sait très bien, les données nous le démontrent, que d'investir dans nos ressources humaines assure en effet une qualité tant au niveau des patients et au niveau de la qualité au travail. Alors pour nous, ça mérite vraiment que chaque employeur prenne le temps de regarder ce que les données donnent et puis de vraiment investir et de mettre les mots en application ici.
If we don't address quality work life at all in healthcare, I think, well, the link has already been made. We know there's evidence there that suggests that we're not going to get the same quality of care, so we won't get the same outcomes. I also think that we'll really struggle to be able to retain staff, to be able to recruit new staff, and the level of engagement with people that are there. You can have people present, but that doesn't mean that they're actually doing a job, feeling good about it, and the impact would be huge. And I think that we've actually seen that. I think that's part of what drove this. Disengagement, dissatisfaction, and poor outcomes and poor bedside relationships, if you will.
And if I could personalize it a bit, my mother lives in long-term care in the facility I work at, and she's on a dementia care floor. So for her to get the best possible health care, I think it's imperative that the frontline staff get the support from their managers, from senior executives, to help them understand that their work life is important to them, because right now they're not getting it. They don't realize that they are important, that the work that they do is very important.
We need strong leadership at the heads of organizations, at the midpoints of organizations and the grassroots of organizations. Everyone has to believe that this is critically important to the well-being of the health system and of the individual health providers, and as I keep saying, at the end of the day, the health of Canadians.
I think you'll see earlier retirements of healthcare workers that are at the older end of the age spectrum. I think you'll see increasing numbers of new nurses, other healthcare workers exit the profession, which is already a problem. You'll see problems with patient care, satisfaction and negative outcomes. Well, satisfaction will decline and negative outcomes will increase. And in Ontario or even in Canada, we're at risk of losing our healthcare workers to other jurisdictions. So that's why we've been working on it for a number of years, and I think that's why you see the wide range of attendance and interest from all the people that are here today.
The importance of this issue to me has to do with the sustainability of healthcare in my community. I'm from my community where I work right now. It's not a very big community, and I really worry about the longevity of our healthcare system there. I think without organizational help, we may eventually not have a healthcare system in my community.
You come here, you get excited, you get inspired, you hear great speakers, you share your own stories and have that opportunity to profile a little bit of what you're doing. So to me, it should be the focal point.
I came to the summit this year mainly just to check in on what's going on across the country. I find it's a very motivating conference to come to. Kind of gets you pumped up again to see that people are doing some really cool things across the country.
For me, this is a true pan-Canadian event. In terms that this morning we were at a table and we just introduced ourselves about the people around the table, and this was a cross-section of Canada, and sharing all that knowledge from across the country that we can use right away was really important. So that's why this network is so valuable.
I really enjoyed the first summit. It was one of the best conferences I'd ever been to. I felt very much stimulated and excited by all the ideas and all the activities happening across the country. It was good for me to find out that our hospital wasn't far behind other hospitals, but that while we had work to do, that we were on the right path. And coming back to the second summit was just a natural fit for the work I'm doing.
I always come to these conferences and I always learn something to take back home that we can use in Newfoundland and Labrador as a promotion, more or less, to promote quality work life in each of our work areas. We're coming to the summit to learn, to express our own opinions and our own ideas, and also to learn from others.
Je suis venu ici apprendre et je suis à date très satisfait de ce que j'entends. Je suis aussi venu chercher du network, du réseautage. Parce que je trouve que le réseautage, c'est peut-être la solution de l'apprentissage de l'avenir. Hein? On apprend des gens qui ont expérimenté, qui ont fait des expériences, qui ont fonctionné, qui ont moins bien fonctionné. Il y a des gens qui vont te donner des insights, des hypothèses. Alors, so far so good, ça va bien.
I think it's fun because it seems that everybody that's here is positive. They want to go forward. Everybody has good ideas, and they seem to be just thinking. It's not a question of attitude that seems to be at the base of this. So yeah, actually, people are doing great things across the country. So I guess I'm going to leave here with tons of ideas.
The impact that I see of these conference or summit is that we have different people. I was here last year, we had 200 different people. And also we don't all have CEOs or chief nurses or nurse managers. We have a mixture. You have practicing nurses, you have nurses and healthcare workers working in the community, in long-term care sector, in the acute care. And they're all coming from a different perspective to get tools to bring back home. And that's the success, is when they can grab a tool that's been tested and has made real changes in somebody else's workplace and bring it back home and change the workplace.
It's a very good event, a great event for all people working in healthcare organizations. Why? Because we have the opportunity to share, we have the opportunity to learn, and we also have the opportunity to see what works and what doesn't work in several initiatives that was put in place in several places across Canada. And I've learned a lot. I'm going back to Montreal with what I need, and it's marvelous. And I think that it was the decision I made to come and attend this summit was a good one.
I think we've come to the summit because we're all seeing each day more significance on quality work-life, quality balance in the workplace, the demands on our staff, the shortages of staff, whatever. Overtime, doesn't matter what indicator we want to use, we see challenges for human resources in healthcare. We spend about 78% of our funds on staffing costs, so it's important that we take a very serious look at this work-life initiative, its collaborative nature, and build the capacity in our workforce to make some positive and significant changes. What I took from the conference today was the level of involvement in people right across the nation. I think all the pieces are now starting to fit together for us, that we understand occupational health and how it fits in. We're understanding absenteeism, how it fits in. So it's to bring all those pieces together so we can get that message to our staff so they fully comprehend what we're up to.
Always an opportunity to network and to meet other people who have a passion for this as well. So I think that's really important. Really, you know, connecting with people who have different ideas or different approaches, the opportunity to participate in the breakout sessions and learn things that have actually been implemented and are making a difference, that's always invigorating.
It is so important to network with people who understand the industry, who knows, who have gone through some of these initiatives that we're starting, and there's a lot of lessons learned.
Really what people are doing on the ground to make healthy work environments a reality, and just the different examples from place to place to place have been really impressive and interesting to me.
I was very impressed by the number of people because the signatory forum was a smaller group, so I didn't know what to expect. So I was very impressed with the numbers and also the diversity of the group. And you always come away with new ideas. You think you have a gist of it all, you think that you've got a good plan and what else can there be, and then you come to a place like this and it's like, wow, I never thought of that.
One of the first things I did when I got involved with becoming the Healthy Organization Leader at LHSC was to look at some of the best practices out there. And the Quality Work-Life Quality Healthcare Collaborative has an excellent reference document within our grasp. I was able to use that document as a springboard for a lot of activities at the hospital. And when I found out there was a summit, I jumped at the chance to come to it.
La collaboration qu'il y a eu entre justement ce consortium pour augmenter la qualité de vie au travail a été phénoménal. Je pense que ça fait 5 ans qu'on voit ici qu'il y a eu du progrès. On a eu des retombées justement au niveau de commencer à voir des programmes qui sont adaptés, des succès. Et puis, je pense que ça démontre justement qu'on ne peut pas faire ceci en isolation. Il faut vraiment travailler en équipe, il faut vraiment se concerter. C'est vraiment une approche collective que ça prend. Ça ne peut pas être juste un individu, ça ne peut pas être juste l'administration. C'est vraiment une approche collective.
I wish there was a way to harness it and bring it all to the fore so that everybody was aware of the rich resource that you've provided through the action strategy. The success that's already been felt related to this particular document is actually all about the collaborative. I don't think that we'd have the strength or the commitment if there wasn't a group of people that were sort of taking this as an issue and championing it.
Si on regarde la coalition, le but était pour regarder à toute la recherche qui avait été faite sur les endroits de travail. Et au début, on regardait surtout au négatif. On regardait comment c'est que les endroits de travail dans la santé étaient si malades. Les employés, que ce soit les infirmières ou les médecins ou les autres travailleurs de la santé, on était tous malades, soit émotivement, physiquement. Et nos assurances montaient, les journées de maladie montaient. Qu'est-ce qu'on pouvait faire? Alors, on a eu des partenariats au niveau national qui se sont rencontrés puis on dit on doit faire quelque chose. Et on a approché Santé Canada pour pouvoir avoir des fonds pour débuter. Et avec ça, on a pu établir la coalition au national.
We're normally concerned with what's in Ontario, but working through a national organization, we can expand those boundaries even further. There's been a lot of great collaboration, and people are open to sharing their resources in a way that might not always be evident in other fields or in other jurisdictions. So I'm encouraged that we'll be able to bring together a lot of the people that are in this room to continue discussing how to get the tools out there to share the knowledge that's already been brought forward.